It's been one of the closest elections in history. And so that tells us that obviously almost half of the electorate wanted that change. So I think that there needs to be a very high momentum kept in order to deliver for that half, and also to convince those who didn't vote for us that we are that change that should happen in future.
The people who voted for the GSLP Liberals, and there were more of them, will probably disagree with a lot of what you're saying, but you still have to work for them.
Oh, absolutely. And we will work just as hard for them, because this is about the whole community. And of course, politics isn't just, or should not be just about a slinging match. So this is about also working together where possible for the good of Gibraltar. So our role is to keep them in check. There was an existing relationship between the health minister and I, in that I have known her for a number of years. I have worked professionally with her in the past, and I would extend my assistance wherever needed and wherever possible, because I think that if on certain issues, obviously we're going to differ, because policy, we're not on the same boat in terms of policy, but I do think that there are areas that we can tackle and we should tackle together as Gibraltarians.
She's conscious of the careful balance that she needs to keep between listening to the public and listening to the clinicians.
Yes, it's music to my ears, and I hope that that's certainly the case, because throughout the campaign you would have heard me say numerous times that this is a health service which has unfortunately been micromanaged on many occasions in the past by this current government, and it's something that needed to stop. And I'm hoping that moving forward it does stop, and that clinicians are allowed to run the health service, because we're not experts in health, and therefore control needs to be given to those experts.
Ms. Arias Vasquez told us yesterday that if clinicians tell the government that the community mental health team facility should not be moved from Coaling Island, where it currently lives, to St. Bernard's Hospital, as they committed to in their manifesto, they will rethink that.
Throughout our campaign, it has to be said, we've been criticised for the fact that we came out saying that we would review things, that we would consult with stakeholders, and also obviously with experts. So it seems to be a U-turn from what was occurring during the campaign. Because obviously they wanted to have this facility within St. Bernard's. But certainly we have also had that information throughout the campaign, that St. Bernard's is not can be said not to be the appropriate place within which to have this. But I do understand that the experts there are experts on different sides of this. So most definitely there needs to be consultation there.